The spread of coronavirus disease 2019 has caused a new global health disaster that puts people in danger. Since it started in the Hunan seafood market in Wuhan, South China, in 2019 and quickly spread around the world, the World Health Organization has called the viral epidemic a public health emergency. The coronavirus can cause upper respiratory infections, diarrhea, and pneumonia in animals. It gives people colds, coughs, sneezes, and pneumonia. This virus can be passed from person to person or from person to animal through droplets in the air. The patient has a fever, cough, sore throat, and shortness of breath, among other symptoms. To get rid of the condition, general treatment, symptomatic treatment, and other methods are being used. This video discusses about coronaviruses, mainly how they spread, what causes them, how to treat them, and how to keep them from spreading. What is coronavirus? Coronaviruses are a type of virus that can make people and animals sick with respiratory problems. The spherical or pleomorphic, single-stranded, encapsulated RNA virus that makes up the coronavirus is wrapped in a glycoprotein that looks like a club. The coronaviruses comprise 4 subfamilies: alpha, beta, gamma, and delta. Animals like birds and pigs have been found to have gamma and delta coronaviruses, but alpha and beta coronaviruses come from mammals, like humans. There is another name for beta coronaviruses, bat coronavirus. A male toddler with a common cold's nasal secretions was the first to contain a human coronavirus. This happened in 1965. The virus was named coronavirus because, when looked at through an electron microscope, it looked a lot like the crown-like structure of the sun's corona. This is because of the spike S-glycoprotein from the virus's surface. The transmembrane glycoprotein M and the S-glycoprotein are essential envelope proteins. The S-glycoprotein helps cells join together by interacting with the receptor and binding to it. The M-glycoprotein helps make the envelopes of virion viruses. History and origin. The first cold case of coronavirus was reported in 1960. A Canadian 2001 study found that 1718 of the 500 people with flu-like symptoms had an infection caused by the coronavirus strain. Before 2002, coronavirus was considered a simple virus that did not kill people. Studies released in 2003 proved the coronavirus spread to other countries, such as the US, Hong Kong, Singapore, Thailand, Vietnam, and Taiwan. Numerous deaths from severe acute respiratory syndrome, SARS, in 2003 were linked to the coronavirus SARS-CoV. This was a sad year for microbiologists. After looking into these issues for a long time, microbiologists concluded that they understood how the disease, which they named the coronavirus, spread. Up to that point, about 8,096 people had been confirmed to have caught the coronavirus. It was called a state emergency by the World Health Organization and the Centers for Disease Control and Prevention in 2004. Another investigation found that 40 cases of severe acute respiratory syndrome in Hong Kong were caused by the coronavirus. Middle East Respiratory Syndrome coronavirus was the name given to the coronavirus, MERS-CoV, in 2012 when Saudi Arabian sources reported that the virus had killed several people and sickened many more. Around the end of 2019, a group of pneumonia cases in Wuhan, China, showed up for no apparent reason. When it was found that the pneumonia cluster was caused by the severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, samples from the lower respiratory tract were put through a deep sequencing study in January 2020. Transmission of coronaviruses: people close to an infected person who is coughing, sneezing, or showing other symptoms can get the infection. The coronavirus is usually spread through the air by zoonotic droplets. The virus replicates in the ciliated epithelium, which damages cells and causes infection at the damaged site. At first, 2019, MERS-CoV was thought to live in the Rhinolophus affinis bat. To get the viruses from animals to people, they need to infect other animals, like palm civets for SARS-CoV and camels for MERS-CoV. Conversely, COVID-19 can be spread from person to person through contact with mucus in the nose, eyes and mouth, and through breathing in contaminated droplets of virus released into the air when someone sneezes or coughs. It is thought that a 6-foot distance is enough to stop the disease from spreading. Microbes inside particle droplets of less than 5 micrometers can stay in the air for long periods and travel over distances of more than 1 meter. The higher risk of transmission during dental procedures is caused by the close contact between people, the chance of getting bodily fluids like saliva and blood on instruments, and using sharp objects. Furthermore, things and personal items close to the sick person may also be vectors for transmission. So, coronavirus disease 2019 can be spread indirectly through contaminated surfaces or objects or directly through contact with infected people. Symptoms. People who have a coronavirus disease display different symptoms like fever, cough, and shortness of breath. Most individuals also show symptoms of extreme tiredness, muscle and body aches, inability to taste or smell, and other symptoms, including sore throat, congestion, and headaches. Additionally, coronavirus disease 2019 may show symptoms related to digestive issues, such as nausea, vomiting, and diarrhea. In severe cases, chest pain and difficulty breathing may also lead to oxygen deprivation, confusion, and blue lips of face. Complications. Coronavirus disease 2019 complications differ significantly in their severity, depending on aging, immunosuppression, or the presence of comorbidities. Pharyngitis, which is a common effect associated with breathing problems, is similar to pneumonia. The virus can induce an exaggerated immune response involving excessive release of inflammatory cytokines, which damage multiple organs of the body and may lead to organ failure. Additionally, patients who have heart disease or heart-related issues like stroke are more prone to severe coronavirus disease 2019 disease symptoms, especially if they have blood clotting related issues. Chronic or long COVID-19 can persist longer and may take weeks to months to go away. Chronic coronavirus disease 2019 leads to long-lasting tiredness, cognitive impairment, pain in the thoracic, and loss of concentration. Evidence suggests that coronavirus disease 2019 might affect other body parts, in addition to the respiratory system. Several studies have found that coronavirus disease 2019 may damage the central nervous system. Symptoms observed in coronavirus disease 2019 patients with damaged central nervous system include difficulty focusing and inability to taste or smell. Even the patient's sight may also be affected in certain patients. People who have a severe coronavirus disease 2019 infection have also been known to have acute necrotizing hemorrhagic encephalopathy, stroke, and seizures. In about half of coronavirus disease 2019 patients, the presence of blood or proteins in the urine is an early sign of kidney damage. Reports say that between 15% and 30% of COVID-19 patients who are hospitalized in China and New York need renal therapies or dialysis. Diagnosis. Researchers use real-time polymerase chain reaction, CT scan, chest X-ray, and blood tests to find positive SARS-CoV-2 nucleic acid, patchy opacities or areas of increased density in the lungs, and the degree of lung damage and IgG antibodies in the blood, respectively. For RT-PCR samples of secretions from the lower respiratory tract are collected, including swabs, sputum, and the throat of a patient who is thought to have an infection. Treatment. Treatment of coronavirus disease 2019 patients is classified into 4 categories for easy understanding. General treatment. A confirmed coronavirus disease 2019 patient needs to stay in bed and get supportive care, such as ensuring they drink enough water and calories to avoid dehydration. To maintain homeostasis in the blood, doctors and nursing staff maintain patients' vital signs and oxygen saturation, count blood cells, test for C-reactive protein, and monitor vital signs and electrolyte balance. This includes checking how well the liver and kidneys are working. Symptomatic treatment. People with fevers that are too high need to be cared for. If the temperature goes above 39, you should take antipyretic medicine. As a prophylactic step, warm water baths and antipyretic patches are recommended for reducing body temperature. Laboratory investigations confirm that chloroquine and hydroxychloroquine can fight viruses and reduce inflammation. Additional information confirmed that azithromycin combined with hydroxychloroquine seems to improve outcomes. Oxygen therapy and antiviral drugs. It is more likely that someone will get hypoxia because the virus targets the lungs. Give the patient an oxygen mask and a nasal catheter right away. Antiviral drugs, including arbidol, interferon, chloroquine phosphate, and ribavirin, have been found helpful. Vaccination. Currently, 4 different kinds of coronavirus disease 2019 vaccines can be used to stop getting the disease. These vaccines are grouped into 4 groups: virus vector vaccines, mRNA vaccines, protein subunit vaccinations, and inactivated or dead virus vaccines. The mRNA vaccines include Pfizer-BioNTech and Moderna, Johnson, and AstraZeneca are viral vector vaccines. Novavax is protein subunit vaccine, and Sinovac and Sinopharm are virus vaccines that have been developed from killed or inactivated. Prevention. The principal preventive strategies against COVID-19 are as follows. Apply a face mask. Use tissues to hide coughs and sneezes. Consistently cleansing hands with soap or hand sanitizer with at least 60% alcohol. Prevent contact with those who are infected. Keep a suitable physical distance from individuals. Avoid direct contact with the nose, mouth, and eyes with unwashed hands. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.